Hi, I'm Evelyn.
And I'm Arlene,
We're here to talk about automatic exposure control.
most commonly known as AEC.
Before we can get into AEC, let's first talk about what an X-ray is. An X-ray imaging creates photos that are inside of your body. The images show part of your body in different shades of black and white. In order to produce an image, the photons exiting the tube passes through the body part into the hard plate, also known as the image receptor.
What is AEC? The stage where the photons hit the plate and produce the image is done with the assistance of AEC. The purpose of AEC is to reduce exposure time and reduce the need to repeat any images. It controls the amount of radiation that reaches the image receptor, and once enough radiation is produced, it terminates the exposure. The AEC exposure time is dependent on the patient's body size. Overall, AEC helps reduce and develop accurate patient exposure, and it assists the radiographer.
Detector cells are part of the AEC system. These detector cells measure the amount of radiation received from the X-ray tube through the patient to the image receptor. They contain different combinations, up to 7, as seen in the image in front of you. The radiographer must activate the detector cells based on the body part being imaged. If the proper detector cells are not turned on and completely covered with the body part, it can cause an under or overexposure, but basically a poor quality image. Just think about a picture with a flash and no flash.
There are two types of AECs, phototimers and ionization chambers. The phototimers are not as commonly used as ionization chambers. In this image, we are able to see that the radiation detectors are located in different areas for each one. Ultimately, both types send a signal to terminate the exposure when the image receptor has received enough penetration.
All AEC devices have a backup timer and a minimum response time. The purpose of the backup timer is in case there is a fail with the AEC unit, the backup timer is activated. Backup timers contain a present time to prevent overexposure. The backup timer is set to 1.5, the expected manual technique exposure time.
AEC is not used when the body part is smaller than the size of the detector cells, as seen in these images. The anatomy of interest must completely cover any activated detector cells. It is crucial to position correctly and collimate, meaning decreasing your light field to get a better image quality.
Some advantages of using AEC is that it reduces the exposure. You're able to turn it on and off, and it reduces the repeat times of having to take an image. Disadvantages of using an AEC is that the radiographer needs to properly collimate, which means that they have to basically make sure that their light field is covering just over the anatomy. Patients also must be positioned correctly. But one of the major things, or the major parts of it being a disadvantage, is that the radiographer loses practice of using manual technique.
To help you understand the concept of AEC, we decided to use pumping gas as our example. Gas pumps have a certain amount of fuel that can go into the tank, and it has an automatic shutoff, like how the AEC functions when an X-ray is taken. So as you see, while we are pumping gas, the pump has a lever that we flicked up to start filling our tank. When the tank is completely filled, the auto shutoff will make the lever flick to stop the flow of gas to avoid an under or overflow. The AEC uses the same concept. It also shuts off when there is enough ionization to the image receptor. This helps create an X-ray image that will help with the diagnosis of the patient.
Okay, this is the end of our presentation. We hope that you understood just a little bit more about the concept of AEC, or at least enjoyed watching this presentation, because we really enjoyed making it. And also just particularly this photo here of us having a nice beer with Simon. We hope that you have a good one. Bye.